Viruses are the most abundant particle of potential living material in the world. And even though they're so abundant, we don't even know if they're alive or if they're not, because it's hard to define what life is, because viruses have genetic material, but they don't replicate on their own. They depend on host cell machinery for replication. Viruses such as coronavirus, which is a single-stranded RNA virus, will typically get inside our cell and use our cell's machinery. But there are other viruses which actually get deeper into our cell, within the nucleus of our cell, and merge with the DNA of our cell. Sometimes these viruses are called retroviruses. Sometimes these viruses can actually get into the germ cells, which are the reproductive cells of our body, and get passed on to the next generation. In fact, 8% of the human genome is comprised of viral genetic code. Each animal had viruses that it had developed immune responses and ways of fighting. What's happened since humans started agriculture is that we've settled down and we started using domestic animals for our subsistence. Consequently, there's been much higher interaction between human beings and other animals. There is potential for those viruses in each of those animals which are constantly mutating to jump species. It's possible that the new species may not have the defense mechanisms that its original host species had. For example, camels got domesticated approximately 4,000 or 5,000 years ago in Egypt. Soon after the domestication of camels, we had the eruption of smallpox. So smallpox started from an original camel host. In fact, the mummy of the Egyptian pharaoh Ramses V, his face is riddled with smallpox scars, similar to what we've seen even till the last century. So we know that smallpox has been wreaking havoc within human societies for thousands of years. In the 20th century, smallpox killed 300 million people. The reported mortality for smallpox was 33%. And in Japan, 1/3 of the population got wiped out because of smallpox. So all this because there was what's called a zoonotic jump, or zoonosis, which is when an infectious organism jumps from one species to another. So birds are the natural hosts of the influenza virus. From birds, influenza is spread into chicken, and through domestication of chicken, we've had several pandemics arise because of influenza virus. For example, the Spanish flu, which I'm sure you've heard about quite often these days, which was in 1918, killed about 50 million people. There was the Asian flu, which occurred in 1957, and that killed about 2 million people. And there was Hong Kong flu, which killed about 1 million people. And even the swine flu, for example, which infected about 1 billion people in 2009, and of those 300,000 people died. And all these were outbreaks of influenza virus. So what is happening with influenza virus? Why is it that there have been so many different outbreaks? Well, influenza virus is a little bit unique in that it has a very high rate of mutation. Like the coronavirus, influenza virus is a single-stranded RNA virus. What that means is two things. One, that it's not as stable as a double-stranded entity would be. Secondly, it can undergo mutations in generally two different fashions. One is that it can undergo what's called Antigenic Shift, and the other is Antigenic Drift. Now, Antigenic Drift is what we often see as to why we have different influenza vaccines and the flu vaccine every year. Because every year, the flu virus, which is the influenza virus, has little mutations where it's drifting from the previous genome sequence that it had. And what happens is it takes about 6 months for researchers to look at which viral sequences are going around in different parts of the world, and which ones are most likely to come around and infect the United States, which is where we are, or every country will do the same thing, depending on when their flu season is. And then they will create a vaccine which is going to act against the most prevalent strains, or the strain that is most likely to infect that country. So that's what we're using with the flu vaccine. In fact, the flu vaccine initially was cultured in chicken eggs. Why? Because it is an original bird source. And that tells you that, again, these pandemics and infections are related to original animal hosts. The other thing that influenza virus, because it's an RNA virus, can do is called an antigenic shift. Now, this is a much bigger change where there's a recombination event between two different strains. For example, the swine flu that we talked about was a recombination between a pig, a human, and an avian influenza strain. As with drift, you have little genome sequences that change through smaller mutations. With antigenic shift, you have an entire recombination of two different strains where a lot of genetic material changes, and therefore with an antigenic shift event, people would have no immunity to this new viral form. And it's estimated that if a virus with the similar virulence to the Spanish flu came about in today's world, again, at least 50 million people would die because it would spread so rapidly. So we've been lucky that we've not had a flu virus that has had a significant antigenic shift event where it's had the same virulence that it could have had. So essentially the concern is that we need pandemic preparedness, and this brings about a lot of issues that we need to think about with a little bit more depth. So what are those issues? One is our relationship with animals. In fact, the majority of human infectious diseases have been caused by zoonoses, which means they've been caused due to our interaction with animals. Of course, with coronavirus or with HIV, where chimps were being consumed for meat, these cases were related to the wet markets and eating animals that we haven't typically been used to eating before. The problem with wet markets, for one, is that you have all these animals coming in from all over the world. Many of them are very stressed and have been caged and are seeing other animals being killed, probably have some sense of the fact that they might be killed, and the level of stress in animals is very high. We know that when there are high stress levels, this reduces immunity, and whatever viruses are endemic to those animals are going to replicate much higher and much more, and so the viral load within those animals is going to be higher than it would even be under normal circumstances. Add on to that you have animal secretions everywhere, and they're interchanging secretions within the same market. They're loaded on top of each other on carts or cages, and then human beings are handling this meat. It's a perfect recipe for viruses to jump. There is a tendency of the host species, the virus may not be very virulent, but then you have the intermediate species where, as you probably heard with coronaviruses, there were intermediate species with civets or with the pangolin for this, possibly with COVID-19 or SARS-CoV-2. And from the intermediate species, you have what's called the spillover species. And what happens with these viruses is often that the host species is not very symptomatic because it's evolved mechanisms. Intermediate species might be mildly symptomatic, but the spillover species often is very symptomatic and has a huge infection. And oftentimes, according to a lot of research, the spillover species has a huge inflammatory response to viral infection, which is what we're dealing with COVID-19. The inflammatory response is excessive and is the main reason why people are dying from acute respiratory distress syndrome. So the issue there, the reason to mention that, is that the host species might be a wild animal, might be a bat, but oftentimes the intermediate species are domestic animals that we're consuming for meat. So there don't have to be new animals or wild animals or wet markets where many of these diseases are passed on to us. There could be domestic animals that we're using with animal agriculture. So point being, we really need to think about the animal agriculture industry. The other issue, of course, is something that could be subjective, is the question of morality. That are these animals, be they cows or sheep, are they sentient creatures? Can they feel pain? Do they want to live? And is it fair that we keep them in an environment where they're suffering for the majority of their lives and then we use them for meat? That we have dominion over them, and how should we use that power that we have over something that has lesser capacity for fighting back than we do? And should we be more humane towards animals? The other issue with the animal industry is how it's affecting the environment. One of the major causes for antibiotic resistance is the use of antibiotics in domestic animals. So there's a multitude of reasons where the animal agriculture industry could be looked at, again, with regards to emerging diseases. So the second issue that we probably should talk about is something that most people don't want to deal with, but is the question of politics, is the question of who are we choosing to be our leaders. Will dictate who's going to be chosen to head the pandemic committee, who's going to be chosen to decide about funding for hospitals, who's going to be responding to the pandemic when it actually happens. And we need to choose leaders who are aware of science, who are aware of understanding data, so that they can make smart, educated decisions. Because we've seen through this pandemic, we didn't really expect that we would have leaders who would take away funding from pandemic preparedness. We had surveillance programs for emerging diseases. For example, even in China, it was expected that coronaviruses would evolve into a possibly virulent strain. And this was not something that was unexpected. In fact, this was already published, that the next pandemic would likely come from a wet market related to coronaviruses, but we stopped our surveillance programs. So the question is, should we choose leaders who are going to be a little bit more in line with the dangers that humanity faces with regards to things that are most likely to kill us, even more so than nuclear war, which is pandemics? The other thing was that this pandemic brought to light that we need a public healthcare system. And there are many advantages to a public healthcare system as opposed to the system that we have right now, which is predominantly a private system. So, for example, there were reports of 2 hospitals in the US bargaining with a PPE production company to buy their supply. And because the hospitals couldn't show funding immediately, because it takes several hours to go through the bureaucratic chain to show where the funding is and to give the money, a third party, which was an international company, where they had money available and immediately could be shown to the company, ended up getting the PPE supply, and neither of the American hospitals ended up getting the PPE. So what was happening is that we're having a competition between hospitals for personal protective equipment. What really should have happened is that if we had a government healthcare system, there should have been a stockpile of PPE, because we had already prepared for pandemics, because we had funding for pandemics, because there was government healthcare. Because a private hospital is not going to make extra ventilators, make extra PPE, or buy extra equipment if it's not going to use it. If we don't have government healthcare, there isn't much incentive for preventative measures. Many people have a job, but they're not insured. For example, if you were a daily wage earner, where you weren't earning enough to buy health insurance, and now when the economy is down, again, you don't have enough money, how are you going to buy health insurance at this time? And if you don't have health insurance and you fall sick, how are you going to deal with that? And is that fair when everybody has an equal propensity and potential to fall sick? It's not your fault if you ended up falling sick. then why is it fair that you end up having to bear the burden and potentially face financial difficulties or not be able to seek healthcare and have adverse events because you didn't go to the hospital when you should have? So this brings about a lot of questions that we needed to think about as a community. Fourth thing that I would say that this really makes us think a little bit more deeply about is the quest for objective truth of what reality is. Now, everybody is entitled to their own opinion, which is totally fine, because there are personal truths, and there are things that, something could be right for you and it may not be right for somebody else. But there are also objective truths, which are not subject to personal opinion. For example, you could say that vaccines cure disease. And this is not a subjective opinion. There is a lot of evidence. The importance of objective truth, of course, also ends up being important when it comes to policy, when it comes to who's in charge. Because if there is no adherence to an objective truth, how are we going to decide whether or not we should give funding for pandemic preparedness, whether or not we should give funding for vaccines? Part of the reason I think that we have moved away from an adherence to objective truth is because we live in a world where we're sort of cushioned. We used to be in a time where people would die of tooth infections, antibiotics, and we don't typically die of simple bacterial infections anymore. Then we used to die of viral infections, such as we discussed with smallpox, but we created vaccines and we're not so susceptible to viral infections anymore. We've created buildings, we're not as susceptible to weather calamities. So we seem to be insulated and have forgotten how it is that we've gotten this lifespan, how we've gotten to a point where our lives are as comfortable as they are. So I think at some level, the fact that we're going through this is a reminder that science does matter. And if you're still not totally convinced, then I think it would be useful to look at how human ingenuity has led to so many cures. The first thing, of course, would be vaccines, because millions of people have been saved by the use of vaccines. The story of vaccines is very interesting, and it actually starts with smallpox. As we discussed, smallpox had been wreaking havoc with human communities for thousands of years. Millions of people died, 300 million people died in the last century. Smallpox was the first disease to have a vaccine formed against it. And the vaccine was formed by a gentleman named Edward Jenner, as you probably just have heard in the past, who noticed that the only people who were not getting smallpox were milkmaids. And milkmaids would get a disease which would affect their hands and caused lesions on their hands, and those lesions were similar to lesions that were on cows whom they were milking. But they didn't develop smallpox. So he had an idea that maybe those lesions, because that disease which cows had was called cowpox, and he thought that maybe having had cowpox gave some immunity to these women, which prevented them from getting smallpox. And his idea was to basically inject the cowpox virus into a healthy individual, which he did with a child, and then exposed the child to smallpox, and the child did not develop smallpox. And this was replicated again and again and proved that vaccination was possible. And therefore the word vaccine comes from vaxa, which is from cow in Latin. So consequently, millions of people got saved. And of course, not just smallpox, then we've had childhood vaccinations for measles, mumps, rubella, chickenpox, for so many diseases, which have saved millions of lives. And the great news with vaccines was that after thousands of years of smallpox, in 1980, smallpox was finally eradicated from the face of this earth. So to recap, today we talked about what viruses are, we talked about how we've dealt with viruses in the past and how we've overcome so many difficulties with emerging infectious diseases. We talked about how zoonotic transfer is almost an inevitability. And finally, we talked about the beauty of science, of how human ingenuity has helped us overcome so many different problems, and how we need to adhere to a concept of objective truth and scientific evidence when dealing with future pandemics and future healthcare concerns, be it public healthcare or pandemic preparedness. If you learned something interesting through this video, then please share it with your friends. Thank you for watching, and I'll see you next time.